Without further ado, I want to introduce the Chief Executive of the MultiCare Inland Northwest region, David O'Brien, to come on up to the stage and have a conversation with me. Let's welcome him to the stage. Thanks, sir. Appreciate it.
Good morning.
You get your pick. Didn't know, we had to add a chair here at the last minute because I wasn't paying attention. So, on behalf of Spokane, welcome. I'm an old Gonzaga graduate. I appreciate that you're here and the changes that have occurred as MultiCare has taken root here. Tell us first, what has that cultural leadership challenge been like to come in and not only explain MultiCare to the Spokane community, but to change the culture within the four walls of the system?
Great question. MultiCare has just celebrated our second-year anniversary in the Northwest.
Yeah.
And I'd like to share with you, it's been an incredible 2 years, and the cultural piece has been important throughout that whole time. One thing that has struck me is this community is incredible. The warm welcome that MultiCare has received is just astonishing. At first I thought, well, this is just the honeymoon period. Everybody, likes you the first, 4, 5, 6 months, but it has sustained itself, and we continue to feel the welcome of this larger community. It's been very, very uplifting and encouraging, and we're very grateful for that. So this first 2 years, we have been very focused on laying the foundation for our future. We're here in the Northwest for the long term, made a long-term commitment when we came here. And we've done a variety of things that have culturally brought together Valley Hospital, Deaconess Hospital, and Rockwood Clinic under a vision of what a delivery system in this market might look like. As opposed to having 3 independent business units, we're culturally moving toward interdependent, and how do we work together toward a common vision of what we think the future should look like.
And so what has been the biggest surprise for you, either externally facing or internally facing, as you've had your feet on the ground here for a couple of years?
Well, the biggest surprise has been that, well, it's actually not a surprise, but you mentioned the cultural piece. The story, the adage is culture eats strategy for lunch every day. And so we are constantly working on transforming ourselves from what previously had been a for-profit delivery system into a not-for-profit. We are, MultiCare is a not-for-profit Washington state-based health system. And one of the things that we believe is that when you are a not-for-profit in a community, you're really accountable to the community. So it's been a lot of work for us to build some of the infrastructure necessary to be good partners in the community, to help address a variety of issues, not just caring for sick people when they're ill, but also being a good partner in the community around some of those social determinants of health, around poverty and homelessness and behavioral health issues, substance abuse, those kinds of things we've worked very hard to get involved with in the community.
Yeah. And to what degree would you say this is an independent outpost of MultiCare? I mean, it's a long ways away from Tacoma, and this sort of represents the first, I think, real big geographic stretch from the system. Clearly, there's some independence, and clearly there's some integration. On a scale of, I don't know, 1 to 10, how would you rate that sort of spectrum?
Well, the vision of MultiCare Health System is to be the Pacific Northwest region's highest value system of health. And MultiCare has been, up till now, been Tacoma, South Puget Sound centric. So to fulfill that vision, that's the purpose of coming into this region. We're in Outpost. I wouldn't really characterize that. We are a part of a larger system But Bill Robertson and Florence Chang, my leaders, are committed to having local control. And that's the reason I am here. Mm-hmm. I am the regional chief exec for 3 business units, and I have a president in each one of those. I've got some really incredible leaders that I have the real privilege of working with. And so we have local control, local strategy, decision-making. We do that in collaboration with the larger organization, and we don't live in a vacuum, but it's remarkable how supportive the MultiCare Health System Board and senior leadership through Bill and Florence has been. I'll share with you that Bill and Florence are out here in Spokane regularly, partnering with us to deal with some of the big issues, as well as help us with some of that cultural work that you mentioned.
You know, I'm sure there are challenges, and I certainly, if I know 1%, I'm surprised that I know that much. But everybody I've talked to has said really glowing things. I'm surprised that the honeymoon, I'm sure, ended, and now it's actually the real stuff. It seems like people are responding pretty warmly.
Yeah, no, and we're very, very grateful to the community for that. You were in your opening comments, you mentioned how complex healthcare is, and it is indeed complex. Mm-hmm. But you put together the right team of people, and you set a vision for where you want to go, and you partner with other like-minded people in the community, and it can create some great results. This area is blessed. We have some great healthcare providers, health systems here. We have some independent groups that have not been a part of the consolidation of healthcare, some independent medical groups. And we have a business community that's very supportive of healthcare. And when I heard about the opportunity to come here, and I heard there were 2 medical schools, a nursing school, a pharmacy school, physical therapy school, and a whole lot of other bio-life sciences and research going on, I thought, what a great community this would be to work in. And it's turned out to be that way.
Yeah, good. You mentioned the vision of MultiCare is to be the Pacific Northwest region's highest value or highest value provider. Where else will MultiCare be acquiring hospitals?
Well, we define the Pacific Northwest as Alaska, Washington, Idaho, and western Montana and Oregon. So we've plucked out the most incredible, best states in the union, and in our view, these are the best places to work and live, and we have plans for the future, and you'll be the first to know.
Yeah, good. Right on. Thanks for letting us be the first to know. Last question. Given all of this stuff, if we were, it's just you and me and our dinner party guests here. Now that we've had a great meal and good wine and all that good stuff, what advice would you give folks who are trying to navigate these choppy waters of healthcare and health policy today?
Well, my world is the provider world. I've practiced medicine, and I've had the opportunity to have a variety of leadership roles in healthcare. And I think for us, it is to find our way forward, to provide value. Volume-based healthcare is waning, and everyone understands we now need to move to a delivery system that is high quality and low cost. And so for us in the provider world, the challenge is how do you do that? What is the right combination of things to achieve that? And as we get closer to being accountable for large populations of health, financially and quality wise, we have to develop that skill set. This is a different mindset than the previous of the more we do, the better we get paid. So I think that's the big challenge for us on the provider side.
It takes some real intention to build that from the provider side. It doesn't just fall into your lap.
Absolutely. It doesn't happen by itself. It's really the creation of a new way of taking care of people.
David O'Brien, the Chief Executive for MultiCare Inland Northwest Region. Thank you very much, sir, for joining us. I appreciate it.
Glad to be here.
Yeah,
thank you.
Thank you.